Welcome to CISO Conversations, EU Data Regulations. I'm your host, Kev Johnson. If you, like so many IT and security leaders out there, are seeking ways to navigate the new EU data regulations, you've come to the right place. We're serving you insights and best practices from leading experts on data security on how the rollout of multiple data regulations within the EU is putting everyone's minds to the test. Today, Nicolas Groh, Senior Manager and Field CTO, is joined by Anastasiya Kiseleva, a PhD researcher in law, health and technologist at the Vrije Universiteit, Brussel. John Noble, former non-executive director at NHS England, and Dr. Stefan Buttigieg, resident specialist in public health medicine at the Ministry for Health and Active Ageing in Malta. They dive into the new European Health Data Space, EHDS, regulations, the evolution of data management in healthcare, focusing on the need for improved security alongside rapid digital transformation, the growing importance of cybersecurity in response to the pandemic, and the role of the EHDS in enabling secure and responsible data sharing in healthcare across the EU. We'll keep today's episode short, sweet, and to the point. Enjoy.
Hi everyone, thank you for joining us on this new edition of the Data Security Talk. Today's special will be focusing on healthcare with the new EHDS regulations coming out very soon. And with me today to discuss that hot topics we have Anastasiya, Stefan and John. I will let them introduce themselves in a minute and we will be having a conversation about the regulation. Anastasiya, if you please.
Good morning, everyone, and thank you very much for the invitation. I'm happy to be the part of the panel. A brief introduction about myself. I'm a researcher in law, health, and technologies. I focus on transparency of AI in healthcare, and I also active in different other areas, and one of them is the European Health Data Space. I published several papers on the topic on legal issues and other issues, and they were cited and referenced by the European Parliament and the European Commission. I also external AI experts at the European Associations of Doctors in Social Security, and I'm affiliated with two universities because my research is interdisciplinary and international. So I'm affiliated with Vrije Universiteit Brussel, and there I'm the part of Faculty of Law. And also I'm affiliated with CISO Paris University, where I'm the part of Faculty of Computer Science. And I'm also the active member of the Health and Aging Law Lab, which is also based at Vrije Universiteit Brussel. So this is some words about myself. Thank you.
Thank you, Anastasiya. Stefan?
Hi everybody. So I'm Stefan Buttigieg. I'm a medical doctor by training, and I am currently working at the Ministry for Health in Malta as a resident specialist in public health medicine, but I spend most of my time working on digital health. And currently I am the manager of the National Contact Point on eHealth in Malta, where I'm focused on primary data use. But really and truly I also spend a lot of time working as well in academia. I work with the European Public Health Association, where I'm the vice president of the digital health section. Also work with the World Federation. And also I have the wonderful opportunity to lecture on digital health, social media and healthcare, and digital therapeutics. But most of all, I love implementing. So I'm very much involved in the day-to-day. I'm working as well on data visualization, data analytics, setting up data pipelines, and really and truly, inevitably, security is a parcel of my day-to-day work. Over to you, John.
Well, thank you very much. My name is John Noble. I'm delighted to be here. I want to say a big thank you to Rubrik for allowing me to be part of this excellent panel. For the last 5 years, I've been a non-executive director at NHS Digital, who look after the core IT systems for the UK National Health Service. About 1.2 million people log on every day onto that system. And I've recently moved across to NHS England, where I lead on cybersecurity for NHS England. Prior to joining that, I was a director at the UK's National Cybersecurity Centre. I led on incident management, dealt with just over 800 different cyber breaches, many of those in the healthcare space. And of course, and we'll come on to later, one of those in May 2014 was the attack, which impacted the UK and many others. And we'll talk a little bit more about that later on, I'm sure.
Do you see that having a big effect on the day-to-day basis? I mean, how do you see the hospitals or oversight of the healthcare having to adapt to actually comply with EHDS, or are they already ready?
So I think it's perhaps worth just exploring some of the obstacles for data sharing. The reality is that most healthcare organizations are federated. There's many different organizations within them. So there's immediately a obstacle to sharing. They have got commercial suppliers who are often not incentivized to create interoperability. And that's become a real problem for that. And they also have, and it's a harsh reality, widely varying standards of cybersecurity, from the very good to the truly appalling. So I think the real value of legislation like this, and of course NIS2, which I think is really important, really good piece of legislation, is to start to be very clear about the standards that are going to be required. And if you don't have those standards in place, you cannot achieve the sort of objectives that this legislation has got. But I think it's very important that we don't underestimate some of the obstacles, because there are a number of vested interests. I'll give you another example. Electronic patient records take many different formats. And doctors get used to working in a particular format. They hate the idea of having to move across to another one. So that becomes another burden when you say, okay, we want everybody to standardize in this sort of format. But I really do think that the value from this legislation, as I say, will be to set the standards, to set an expectation and start a journey to make some of those changes. And it clearly is really important, particularly for primary care, as we're talking about, but also, as we've just heard, for research, it's also important, not least because of the need to retain the confidence of the people whose data is going to be shared onto third parties. Being confident that the work which to remove the most sensitive data really has been effective. And that they can be confident that their information is not going to be leaked. So really important legislation, but we shouldn't underestimate some of the obstacles that we're going to face in bringing about these changes.
No, I agree. And Stefan, how do you see that on a ground level? I think you agree. I think you nodding. I think you agree with John. How do you see those coming into potential hurdles or issues within a healthcare organization?
So, for example, and here I might slightly disagree with my colleague Anastasiya here, because I think that secondary use is also very important, even though I advocate for primary use and I work every day in primary use. So I really see that secondary use should not really, it has a really big importance here. But we are in a situation here where even the idea, for example, that in the EHDS, there is the idea of a secure processing environment. If I had to explain it very, very, very easily, I would say that the data is stored in this secure processing environment. Researchers are given access to this secure processing environment. They analyze the data in this environment, and then they retrieve the relevant statistics that they need. Now, how would this look in real life? That means that if someone uses a secure processing environment, it won't be, data won't be easily retrieved in the same way that we just download an Excel file from a server where we might not possibly know where it is stored, where the data is stored. Like in that kind of mentality, we will be changing this mentality. And that's why EHDS is really, really important here, because even the idea of processing data, there's a structure to it. There is a way, there is an environment, there is a safe way to do this. And I think that is going to be really game-changing. Now, the issue is you need to afford this secure processing environment. Will a small hospital in the middle of nowhere afford this secure processing environment? How are we going to tackle these issues? How are we going to get, for example, is the EU at a higher level going to work on developing a secure processing environment? I hope so, because there will be then issues of equity, like equity even access to secure processing environments. Because what will happen most probably, if this is not ensured, then there will be smaller organizations with significant amount of data, nonetheless, that can be more prone to attacks because they don't have all the relevant resources. So we really need to advocate through these panels, advocate through our daily conversations, advocate really and truly to make sure that the secure processing environment, which is a combination of both data and security, is really and truly available for everyone. I really hope so, and I will keep on fighting for this really on a daily basis. And like another thing that I want to point out is that part of the FAIR principles is interoperability. And I'm seeing a lot of work. By the Expand the Age project. There are a number of EU projects working even on a standard like EEXHRF. EEXHRF, yes, because sometimes you have to say it so quickly that you get to forget how to say it in the right way. So there are standards, and even in my head at EU infrastructure, which is primary use, once again here, there's a lot of standards being developed, and now not only just for patient summary and the prescription, but also for other kinds of modalities, medical imaging, lab test results. A lot is happening there, and I think really the EU is driving a lot the discussion here. Over.
Yeah, I think, and what I've been hearing a lot across Europe and even Middle East as well is that there is a lot to be done. And one of the things I think is key is really identity and access management. I mean, when we were preparing this call, you mentioned about like people in the ICU having to open the door or actually identify themselves with a card. And I see that point, I mean, even further. I think about my doctor in my French countryside having to authentify himself to actually be able to download data from a patient coming from another part of Europe, like the Netherlands or somewhere else, and having to authentify himself. The whole idea of having a fob or having a key and all that may be difficult. I really see that being a big issue to get adopted, but also, as you mentioned, potentially creating a gap at some point with how much or how far you can treat a patient because you may not have all the right access to that. And I think that will be kind of crucial going forward. How we can actually get to that point. What do you think, John? I mean, do you agree with that idea of identity access management being one of the big issues? Do you see other parts of the healthcare organization having to focus or change on?
I think this brings us to the heart of the issue, isn't it? Which is, how do you balance the usability for those healthcare professionals with the need of security? My own view, I'm afraid, is quite a hardline view. If you don't have multi-factor authentication on a system now, you are incompetent. Okay, and if you're talking about patient data, you really should not be allowing anybody to have access to this. And I think there's always a danger that we come up with a particular use case. Maybe it's the nurse working in a rural area where there may not be a phone signal. There are ways around this. So we've now mandated multi-factor authentication across the UK health service, and it's something which is going to be challenging to implement. But really, when we look at the root causes for the attacks which are happening, it's because of an absence of multi-factor authentication. So I think we have to say, identity management is absolutely critical. And obviously MFA is just one part of that. And we can, I'm sure you guys at Rubrik can talk more about what you can do, what's available there. But we have to, if we're going to retain the confidence of users, have set standards. And, I think, MFA is one example of where we have to be very, very strict.
I agree. We are actually the first backup cybersecurity company to enforce MFA everywhere. So we do agree. We do agree. Anastasiya, this will be a key part, but as John mentioned, NIS2 is really what should be the standards. GDPR as well. And EHDS is not going to replace or supersede any of those, but really will actually be built on them. I think that's important to mention. And what's your take on that?
Well, this is super hot topic that you just raised about the tension, I would say, not even correlation between those regulations, but
I'm sorry.
No. Yeah, like it's kind of, the issue here, or I don't know, the perspective here is that we can see that the EHDS proposal changes a lot about how we perceive data and how we use it, completely our approach to data. GDPR, on the other hand, so like the aim of the EHDS proposal is to enable usage of data and sharing, while GDPR, for example, is to protect data. So these two are just on the opposite sides. And the EHDS proposal is making completely difficult task to combine them together. One thing that is kind of helping is that because of this distinction between primary and secondary use, primary use, because it's completely identifiable data, it's personal data, GDPR is in full applicability here, and the EHDS just gives additional rights to patients in this regard. As already we discussed, and John mentioned that this identity management, for example, is also important to enable trust of citizens. And the scope of rights, of their rights, is extending. And then secondary use is a bit different story because it combines both personal and non-personal data. And there is a lot of discussions about should we give the choice for citizens for sharing data for secondary use? And there are several options. In the initial proposal, they say that they give option, but in fact they don't. And now they kind of compromise to say that it's going to be opt-out procedure, but also the citizens advocates say that it should be opt-in. But if it's opt-in, then we might be in the situation that it's impossible to share data because it will be prevented by citizens. But also that's why it's also super important to enable trust of citizens, because they share their data, we get data from them, and that's why it's also very important to provide security. And because if there are, for example, some security breaches, they might also avoid sharing their data. And that's why there's a kind of two-tier security compliance, as we said, like NIS directive, and this also field is expanding heavily the legislation on cybersecurity. And this goes also hand in hand with the EHDS proposal. So there is improvements there, and EHDS will be part of this general framework, but there will be also specific requirements, which are still to be developed and to be specified, because we are just in the initial phase of the proposal as well.
Yeah, I think that will be very interesting, and I hope we can take a part on that, because it is, the whole idea of anonymization of that data to a certain extent, because I was reading the regulations and thinking, but still there are some stuff, you need to know if that person is a male or a female, because at some point that may influence the medicine that you're going to create, or what you're trying to actually find out statistically. Same thing for the age of the person. I mean, that could be a big factor. I mean, do you have more risk of having an answer at 47 or 46? You need to have that kind of idea. So, anonymization to a certain point while still keeping the right data that you need. I think that is going to be difficult. What do you think, Stefan? Is that achievable with what we have today?
I think it is. In fact, to be honest with you, even I personally have to develop expertise and competence in being able to link two different data sets whilst securing anonymization. And there are different techniques to do this. Now, I'm not going to really go to the depth of all of this, but I think what we really need to focus, and that's where I want to reiterate as well, what John and even Anastasiya alluded to, we really need to improve the user experience of data management. That means that being secure will be so easy that it will be by default. People will simply go for the more secure option because it's so easy to use. So many people, for example, they come to me and they say, that person is not using it in the right way. They're doing something completely different. And I just ask them, have you looked into the user experience? Does the interface work well if you had to use it? Is it really easy to use? We have to remind people that, yes, that we really need to work hard to ensure that being secure is the easiest thing to do. That really needs to be the main message today. And that's where the regulation comes in, and that's where the standards come in, the interoperability, all of this comes together, that it has to be extremely easy and extremely user-oriented to be secure. And now we're seeing the technology evolve, and I think looking at all of this, we also need to upskill. We need to get people on board. We need to get champions so they advocate for the ideal user experience of data security. I think that really needs to focus. And Rubrik, yes, you have a role in advocating for all of this. So I really hope that you take it to the next level.
Yeah, I believe so. I mean, it's I think being able to do that on the backup data instead of doing it on the production data would actually bring something to the table. But we'll see that in the future. One final word maybe from you as we are approaching the end of this roundtables, and thank you again for participating. John, what do you see coming next? I mean, is the future bright? Will that regulation help? Do you have maybe a final message you want to share with our audience?
So I think that this is firstly really important legislation, but it's just one step. You've got to see it alongside NIS2. You've got to see it alongside all of the other changes. I think that the key message is that data is absolutely vital for healthcare systems. The only way we can cope with the pressures which are on it to embrace it, but we must do so in a secure way. And we must keep in step the security as we develop better data sharing. They've got to be aligned. If we fail to do that and we end up losing large amounts of sensitive data, we will undermine confidence of citizens in what we're doing, and that would be disastrous for us.
I agree. Stefan?
I think as I would reiterate on the importance of regulation and even the European Health Data Space being one of the first actual data spaces of the European Union has a big role. But I would like to also remind people not to underestimate as well social engineering. So we need to really be cognizant of this fact that the European Health Data Space is a big step forward, but let's educate people about social engineering. And that's also a potential cybersecurity threat, especially for healthcare, when it is such an emotionally driven field. Let's make sure that social engineering plays a big role in all of this and has a mention as well. Over.
No, and I think you're really right. Social engineering is the biggest threat right now and is being used in 95, if not 98% of the attacks. I mean, it is the vector, and it's something sad, but people don't break into environments anymore. They log in. And that is what we are unfortunately fighting every day. Anastasiya, final word.
Thank you. As you could guess, I would definitely advocate for the EHDS proposal. I think it's a great idea, but of course, there is a lot of work to be done for companies to be prepared and to prepare their infrastructures. The EHDS is a very ambitious project. With many complexities to be solved, but to be innovative, to bring the progress in healthcare, to bring the level of healthcare provision to a completely different level, we have to be innovative. This applies to the technologists, but also how we deal with the technologists and with the data. So we should be innovative in that sense, but also at the same time to be careful. And I think this is what the EHDS will do, and I hope it will also bring the amount of data usage to a different scope, and also the maturity of data governance to also completely different level. I see the future like this.
I agree. Data governance, data security are pillars that all companies of basically every size needs to work on, and having a regulation to force them and to lead the way, to guide the way is key. So we definitely need that, and that will be the first step into I hope a more secure future. Thank you very much, you three, for participating into those discussions. Much appreciated the opportunity to actually enlighten us, and we'll see you hopefully next year. Thank you very much.
That wraps up today's episode of CISO Conversations, EU Data Regulations. For more insights on navigating data regulations, make sure to visit our website at rubrik.com and subscribe to our YouTube channel. Rubrik is on a mission to secure the world's data. We help organisations uphold data integrity, deliver data availability that withstands adverse conditions, continuously monitor data risks and threats, and recover their data when they're attacked. Make sure to hit the subscribe button so you don't miss out on future episodes. See you next time.